When you come to Phelps Hospital, you're really treated like a member of the family.
This relationship with Northwell has now allowed us to do extraordinary things.
I am Dr. Yafel Cerulli. I am the Director of Neuroendovascular Surgery at Phelps Hospital and a faculty in the Department of Neurosurgery at Northwell Health. I specialize in the treatment of vascular pathologies of the brain, the head, and the spine. Typically, when a patient has a vascular pathology of the head, they feel very nervous about it. That being said, because we're highly subspecialized, we feel very comfortable dealing with these kind of pathologies, and that's what we aim to provide every patient that comes in.
My name is Buzzeo, and I'm a nephrologist here at Phelps Hospital. The accident was May 17th. I tripped over some uneven concrete, unfortunately landed on my head. My head bounced like 3 times on the cement. Police were called, an ambulance was called, and I was brought to Phelps Hospital here to the emergency room. But I had no memory of that whole event that I just told you. That's all from my wife. So 2 weeks later, I showed up for my CAT scan. Things have gone the wrong way. Dr. Silva called me and said on the table would be a new procedure. It had only been around for about 3 years, but we were going to sit and talk about it in a more formal way with Dr. Cerulli, the neuroendovascular specialist who would do the procedure. And I was very impressed with their caring, their compassion, and their confidence in doing this procedure. And decided that afternoon, a little chat with my wife, and we decided we're going to do it here. Dr. Cerulli came to me afterwards and told me that everything went just the way he had hoped it would go. And I went home that evening. This was the best result we could have hoped for. 3 months from the time of the accident, I was back at work, feeling well, exercising, and very grateful, which just a few years ago, this would not have been available to me.
I think as a field, the most fulfilling thing is that we're able to treat patients who are very close to dying sometimes, or very close to being very, very incapable to do daily things. And we're able to treat them and bring them back to normalcy. I think nothing beats that.
I feel great. Just made rounds at the hospital. I think this is a top-notch neurosurgical team, and I would highly recommend it. And I'm as grateful as I could possibly be. The only thing I'm more grateful for is my wife.